Last year, I opened the chest of a 67-year-old man whose arteries looked like concrete pipes. He was on 4 blood pressure medications. 4, and his pressure was still dangerously high. He was not lazy. He was not ignoring his health. He was doing everything his doctors told him to do, faithfully for years. And yet there he was on my operating table, his cardiovascular system quietly deteriorating the entire time. What nobody had ever told him, what I am going to share with you today, was that the answer had been sitting in his kitchen the whole time. 5 simple evidence-backed things. No new prescriptions, no side effects, just food working the way food was always meant to work. Stay with me, because by the end of this video, you will know exactly what to do, and you can start tonight. Before we go any further, if you are new here, welcome. I am Dr. Anthony, and from right here I bring you honest, evidence-based health information every single week. The kind of information I wish every one of my patients had access to long before they ever needed surgery. If this sounds like something you want more of, please hit that subscribe button right now and ring the notification bell so you never miss a video. And if you are watching from somewhere in the world, drop your city and country in the comments below. I absolutely love knowing where my viewers are tuning in from. It genuinely means the world to me. And if this video helps you or someone you love, please give it a like and share it with your family and friends. That one small action could change someone's life. Now let's get into what you came here for. Let me tell you something they do not always explain at the doctor's office. After the age of 60, your blood pressure does not just rise because of stress or too much salt. Something deeper is happening inside your arteries. I want you to think of your blood vessels like a garden hose. When you are young, that hose is flexible. It stretches. It absorbs pressure. It handles the flow without any trouble. But as you age, the walls of those vessels begin to stiffen. They lose their natural elasticity, and a rigid hose simply cannot handle the same pressure that a flexible one can. That is when things start to go wrong, and in many cases that is when people end up on my operating table. Here is what makes this deeply personal for me. I have spent 30 years as a cardiac surgeon. I have held human hearts in my hands, and repaired arteries that looked like they belonged in someone 20 years older. And every single time I ask myself the same question, how did it get this far? The answer more often than not is inflammation. Chronic, silent, slow-burning inflammation in the walls of the blood vessels. You cannot feel it. There is no obvious symptom. But day after day, year after year, it quietly stiffens and narrows those vessels, forcing your heart to work harder and harder, just to push blood through. So why does food matter so much in all of this? Because what you eat 3 times a day is either fighting that inflammation or feeding it. Every single meal is a decision your body makes about your blood pressure. Most people do not realize this, and doctors do not always have the time to explain it during a 15-minute appointment. That is exactly what this video is about. Not replacing your medication. I want to be absolutely clear about that. But giving your body 5 powerful tools that work alongside whatever your doctor has already prescribed. Tools that in many cases I have personally witnessed make a dramatic difference, sometimes within just a matter of days. Are you ready? Let's begin. Here is a question I want you to think about. When you sit down for dinner tonight, what do you reach for first? If you are like most people, it is the bread, the rice, the potatoes, or whatever is closest. I want you to try something different. Something that sounds almost too simple to be taken seriously. Eat your vegetables first, before anything else on that plate, at every single meal. I already know what some of you are thinking. That is the big secret from a cardiac surgeon. Just hear me out, because the science is genuinely remarkable. When you eat vegetables first, the fiber in those vegetables forms a kind of mesh inside your stomach, a physical barrier that slows down dramatically how quickly sugar from the rest of your meal enters your bloodstream. Why does that matter for blood pressure? Because every time your blood sugar spikes sharply after a meal, your body releases a flood of insulin, and that insulin surge causes your blood vessels to constrict and tighten. Right there at the dinner table, your blood pressure is climbing, and you have no idea it is happening. I have had patients who changed nothing else. Same food, same portions, same medications, just the order. Vegetables first, protein second, carbohydrates last, and their post-meal blood pressure readings dropped noticeably within 2 weeks. One of my patients, a retired teacher who was 71 years old, called it the easiest thing she had ever done for her health. She was not wrong. Tonight, before you touch the rice or the bread, finish those vegetables first. The order in which you eat matters more than most people ever realize. Now let us talk about something that has likely been sitting in your pantry for months doing nothing useful. Apple cider vinegar. 1 to 2 tablespoons in a full glass of water with every meal. That is it. I can already hear the skepticism, and honestly, healthy skepticism is a sign of an engaged mind. So let me walk you through exactly why this works, because there is real peer-reviewed science behind it. The active ingredient in apple cider vinegar is acetic acid, and it does two very important things for your blood pressure. First, it improves insulin sensitivity. Remember those post-meal blood sugar spikes that squeeze your blood vessels? Acetic acid blunts that spike. It helps your cells respond to insulin more efficiently, so your body releases less of it. Less insulin, less constriction, lower pressure. Second, and this genuinely excited me when I first encountered the research, acetic acid stimulates the production of nitric oxide in your blood vessel walls. Nitric oxide is your body's own natural vasodilator. It tells your arteries to relax and open up, essentially doing what an entire class of prescription blood pressure medications tries to do, for about $3 a bottle. One important caution: never drink it straight. Always dilute it in at least 8 ounces of water. Undiluted vinegar can damage your tooth enamel and irritate your esophagus. Use a straw if you can, and if you have any history of stomach ulcers or acid reflux, speak with your doctor first. But for most people over 60, this is one of the simplest, safest additions you can make. 1 glass with breakfast, 1 with lunch, 1 with dinner. Give it 3 weeks and check your numbers. Let me ask you something. Do you check your blood pressure in the morning? Most people do. But here is something almost nobody talks about. What is happening to your blood pressure while you are asleep? For many people over 60, blood pressure does not drop the way it should during the night. It should go down and give your heart a rest. But in a condition called nocturnal hypertension, it stays elevated or spikes. While you are lying there completely unaware, your heart is working overtime, and your arteries are under stress, which is why you wake up feeling tired with no clear explanation. Nocturnal hypertension is one of the most underdiagnosed and dangerous patterns I see. It is linked to a significantly higher risk of stroke and heart attack. And the troubling part is this: your regular daytime readings will not catch it. You can have perfectly acceptable morning numbers and still have a serious problem occurring every single night. So what do walnuts have to do with any of this? Quite a lot, as it turns out. About 30 grams, roughly 14 walnut halves, eaten approximately 30 minutes before bed has been shown in multiple studies to meaningfully reduce nighttime blood pressure. Here is why. Walnuts are one of the richest plant-based sources of alpha-linolenic acid, a plant-based omega-3 fatty acid. They also contain melatonin and a compound called L-arginine. Together, these three work to relax the walls of your blood vessels, reduce vascular inflammation, and support that natural nighttime pressure drop that your cardiovascular system is supposed to make. Think of it as a gentle signal to your entire cardiovascular system. It is time to rest, stand down, recover. 30 grams, 14 halves, 30 minutes before bed. Write that down somewhere, you will see it. It is one of the simplest things I recommend in my practice, and one of the most consistently effective. The results I have seen in patients who commit to this habit have genuinely reinforced my belief in the power of targeted nutrition. Now I want to tell you about a flower. A deep, vibrant red flower used in traditional medicine across Africa, Latin America, and the Middle East for centuries, and that modern cardiology has finally caught up with: hibiscus tea. 3 cups a day. If you have never heard of hibiscus tea before, you may know it by another name: sorrel, carcade, or simply red tea. It has a wonderfully tart, cranberry-like flavor, and it is remarkably powerful. Here is the science. Hibiscus flowers contain compounds called anthocyanins and organic acids, specifically hibiscus acids, and these compounds act on your blood vessels in a way that is strikingly similar to a class of prescription medications called ACE inhibitors. You may have heard of ACE inhibitors. They are among the most commonly prescribed blood pressure drugs in the world. What they do is block an enzyme that causes your blood vessels to constrict and stay tight. Hibiscus does the same thing naturally, and without the dry, persistent cough that so many of my patients complain about as a side effect of the medication. A study published in the Journal of Nutrition found that drinking hibiscus tea daily reduced systolic blood pressure by an average of 7 points in adults with mildly elevated readings. 7 points. That is clinically significant. That is the kind of result that makes cardiologists pay close attention. 3 cups a day, hot or cold. No sugar, or very minimal sugar, because sugar will actively work against everything we are trying to achieve here. A small spoonful of honey, if you truly need it. That is perfectly fine. One important note before you start. If you are already taking an ACE inhibitor medication, please talk to your doctor before adding hibiscus tea to your daily routine. Because combining a natural ACE inhibitor with a pharmaceutical one can push your pressure too low. That is not the goal. We want balance, not overcorrection. But for most people, this is a beautiful, simple, genuinely enjoyable habit. A warm cup of red tea in the morning, one in the afternoon, and one in the evening, your arteries will notice. Now I want you to walk to your kitchen after this video, open your cupboard, and look at what cooking oils you have in there. What I am about to tell you may be the single most important thing in this entire video, and it is the thing that food manufacturers have spent enormous resources making sure you do not fully understand. Most cooking oils that line supermarket shelves, canola oil, soybean oil, sunflower oil, corn oil, are extremely high in omega-6 fatty acids. Now, omega-6 is not inherently harmful. Your body needs some of it. The problem is the ratio. For most of human history, people consumed roughly equal amounts of omega-3 and omega-6. Today, the average person consumes 15 to 20 times more omega-6 than omega-3. 15 to 20 times. And that extreme imbalance drives something every cardiologist and cardiac surgeon dreads: chronic systemic inflammation. Remember that slow-burning inflammation in your blood vessel walls that I mentioned earlier? The kind that stiffens your arteries year after year, quietly and invisibly? Excess omega-6 from these refined oils is one of the primary fuels feeding that fire. Every time you cook with canola or soybean oil, you are adding inflammation directly to your cardiovascular system. And here is what makes it even worse. These oils are unstable at high heat. When you bring them to cooking temperature, they oxidize. They break down into toxic compounds called aldehydes, which are directly harmful to blood vessel walls. You cannot see it happening. Your food does not taste any different. But the damage accumulates with every single meal, over years and decades, until one day someone ends up on a table like the 67-year-old man I told you about at the beginning of this video. So what should you use instead? Two things. Extra virgin olive oil for everything that does not require very high heat, salad dressings, light sautéing, drizzling over vegetables. It is rich in oleocanthal, a powerful natural anti-inflammatory compound, and in monounsaturated fats that actively support healthy blood vessel function. Decades of research back this up. And for higher heat cooking, real butter. Yes, butter, not margarine. Margarine is made from the very same problematic vegetable oils we are trying to eliminate. Real butter from grass-fed cows, used in reasonable amounts, is a far better choice for your cardiovascular system. I know this goes against what many of you were told 20 or 30 years ago. The butter is bad, use vegetable oil message was everywhere. But the science has moved on, and as a cardiac surgeon who has seen inside thousands of chests, the evidence now points clearly in a different direction. Check your cupboard tonight. When your canola or soybean oil runs out, replace it with extra virgin olive oil. That one change alone over 3 to 6 months can make a measurable difference in your inflammatory markers and your blood pressure. I want to pause here, because something important needs to be said. You have just heard 5 strategies. Eat vegetables first, apple cider vinegar with meals, walnuts before bed, hibiscus tea 3 times a day. Replace the wrong oils, and I can already predict what some of you are thinking. This sounds too simple. If it really worked, my doctor would have told me. I understand that reaction. I had it myself early in my career. But here is what 30 years of opening chests and repairing damaged hearts has taught me. The most powerful interventions are almost never the most complicated ones. The body is not looking for complexity, it is looking for the right conditions to heal itself. And what still amazes me is this. Every single one of these 5 strategies works through the same fundamental mechanism, reducing inflammation and improving blood vessel flexibility. 5 different doors, all leading to the same room. The man I told you about at the beginning, the 67-year-old with the concrete arteries, after his surgery, I sat with him and his wife and walked through all 5 of these strategies. He made every change slowly and carefully, in conversation with his cardiologist. 6 months later, he came back for his follow-up. His doctor had reduced him from 4 medications down to 2. His inflammatory markers had dropped significantly. His blood pressure was stable for the first time in years. He looked 10 years younger. And the first thing he said when he walked through the door was, "Why did nobody tell me this sooner?" That question stays with me. It is part of why I make these videos. Because the information exists, the research exists, but somewhere between the laboratory and the doctor's office and the patient at their kitchen table It gets lost. You are at that kitchen table right now. You have everything you need to start tonight. So let me bring all of this together one final time. 5 changes. Eat your vegetables first at every meal, before the bread or the rice. 1 to 2 tablespoons of apple cider vinegar in a full glass of water with each meal. 30 grams of walnuts, about 14 halves, 30 minutes before you sleep. 3 cups of hibiscus tea every day, hot or cold, minimal sugar, and replace your canola and soybean oils with extra virgin olive oil and real butter. No exotic supplements, no expensive equipment, nothing requiring a prescription. Here is what I want you to do right now. Before you close this video, pick just one, not all 5 at once, just one that feels most manageable for you tonight. Maybe it is starting with vegetables first at dinner. Maybe it is ordering some hibiscus tea. Maybe it is simply checking that oil cupboard. Just one, start there, because sustainable lasting change does not come from trying to overhaul everything at once and burning out within a week. It comes from one small decision, repeated consistently, until it becomes invisible, until it is simply the way you live. I have seen this work not in theory, but in real people in their 60s, 70s, and 80s, who decided it was not too late to give their bodies better tools. It is never too late. Your blood vessels are remarkably responsive. Give them the right environment, and they will respond. I would love to know which of these 5 strategies you are going to try first. Tell me in the comments below. I read every one of them. If this video helped you or someone you love, please share it right now on WhatsApp, Facebook, or wherever your family and friends are. There are people in your life who need exactly this information and have no idea it exists. If you have not subscribed yet, please do it now. Every week I bring you honest, evidence-based information that I wish every patient of mine had access to long before they ever needed surgery. Hit the like button if this was valuable, and let me know in the comments where you are watching from. I want to see every city and country represented here. Take care of your heart. It has been working for you every minute of your life, without asking for anything in return. It deserves this, and so do you. One final and important note before you go. Everything I have shared today is general information based on current research and my own clinical experience. It is not a replacement for your personal medical care. Please do not stop or reduce any medication your doctor has prescribed without speaking to them first. Bring this information to your next appointment and have that conversation openly. Your doctor is your partner in this journey, and these 5 strategies work best when they work alongside proper medical supervision. I will see you in the next video.